Hello friends, Dr. Jayashree Todkar here, laparoscopic and bariatric surgeon. We are going to talk about some common queries regarding the surgical treatment of obesity which patient asks us usually. Most of the patients present with additional disease along with obesity where additional surgical treatment may be needed. For example, hernia. It can be umbilical hernia at the navel or the inguinal hernia, or it can be any hernia of the anterior abdominal wall. Can the hernia operation be combined with the operation of obesity? Yes, if the patient has got central obesity, if the BMI is more than 35, then operating only on the hernia is not a good idea because the intra-abdominal pressure is high. Today you operate on one hernia, the pressure will give you another hernia. So it is recommended that in these patients, bariatric surgery should be done and the hernia also should be handled simultaneously or later. If the hernia is painful, if it is not going back, if there is a chance of complication of the hernia, then yes, operation of bariatric surgery is done and immediately under the same anesthesia in the same sitting, we can go ahead with the hernia operation also. This gives you two advantages. Number one, both the diseases are treated and at the same time both of them help each other, because once the intra-abdominal pressure starts coming down after bariatric surgery because of the weight loss, the hernia is no more a tension and it starts healing pretty well. It doesn't create any additional hernias. And if you have undergone hernia operation, then automatically you can go ahead with breathing exercises with more intensity, with lot of other exercises within a month's period after the surgery. The other common surgical problem which the patient may present with obesity is gallbladder disease. Usually, obesity patients have got fatty liver, and fatty liver causes high lipids, lipid imbalance, which leads to gallstone disease, and the gallbladder is usually with thick bile or flooded with stones. Patient may give the history of any previous attack or not. So treating the gallbladder disease via the removal of gallbladder laparoscopically can be combined with the operation of bariatric surgery, but if the patient's liver is fatty grade more than 2, or if the patient's liver span is high more than 12 centimeters, or if the patient is having very high central obesity, then we try to avoid the operations combination in the same sitting. Then the patient should undergo laparoscopic bariatric surgery first, followed by, after 3 to 6 months, laparoscopic gallbladder operation. Why? Because the liver is high during the bariatric surgery, the liver is heavy during the bariatric surgery. Reaching the gallbladder and doing the operation safely may not be very feasible or safe. At the same time, we should note that for bariatric surgery, we give the patient blood thinning medicines one day before, and that can lead to problem during the bariatric surgery if we combine the gallbladder operation. So let your surgeon decide whether you are the right candidate for the combination of operation in the same sitting or not. The third type of common problem seen in these patients is GERD or the gastroesophageal reflux disease or the hyperacidity which these patients suffer from. As per the Gastroenterological International Society's guidelines, any patient with central obesity with BMI more than 35, if is suffering from the reflux disease or if is suffering from heavy acidity, then please do not do the operation only for the reflux because it is bound to fail. Because of the high intra-abdominal pressure, the operation for the reflux usually fails in the obese patients. So in that case, you should combine the operation of the bariatric surgery and the operation for prevention of reflux in the same sitting. Again, let your surgeon decide. We usually do the gastroscopy for these patients before the operation so as to understand what is the level of degree of reflux, and if need be on table combine both the operations. But remember, gallbladder disease, the hernia and the reflux disease are three commonly associated diseases with obesity, and they can be combined with bariatric surgery at the discretion of your surgical team. Let the surgeon decide for you what is good for you, what is safe for you, and all these three conditions in an obese person can get a fantastic significant relief once the bariatric surgery is done. If any query, let us know on the given numbers. Thank you.